Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN. Healthy you, healthy nation, healthy world. I'm Nancy Valentine, PhD and registered nurse. And this show is dedicated to you, the healthcare consumer. And we hope that this show will help you with tips and information to guide your journey for health and wellness. And to that end today, I'd like to welcome our guest, Betty Long. Betty Long is a friend and colleague who I've known for a number of years and who I greatly admire. And I want to tell you why. Betty started out her world of work as a journalist. She didn't even think about becoming a nurse, unless she tells us differently later. But she started out in journalism, and then she decided to become a nurse and got a diploma at the Abington Hospital School of Nursing, and then journeyed on to get a master's in health administration at St. Joe's University. And then, as she will tell us, she became a nurse in the bedside, later on in management, and her area was in critical care ICU. She did a lot of work in the Philadelphia hospitals like the MCP, Einstein, a number of other locations, and she was the director of cardiology outpatient services at MCP. And then she'll tell us how she learned from her experiences that really led her on her journey to become a nurse entrepreneur. Very few nurses are truly nurse entrepreneurs. They may have ideas about being entrepreneurs, but I think what Betty will tell us is how she actually made her dream become a reality when she became the president and founder of Guardian Nurses Healthcare Advocates. And she will, of course, tell us about her company, the services that she's been providing for a number of years now, and what a great job she is doing for many individuals and families. So I think that as a pioneer in health advocacy, I want to welcome Betty. It's a pleasure to have you and for you to be with our guest today.
Thank you. It's good to be here. Thanks for having me.
You're welcome. So tell us about your life. You know, how you got started.
How much time do we have?
We have about a half hour. I know we could go on and on, but you know, give us the high points.
Right. Well, as you said, my degree was initially in journalism. I was at Temple University, and I wanted to be a sports writer.
Really?
But life threw me a curve. My mom became sick with cancer when I was a senior at Temple. And she died, she was actually at Bryn Mawr Hospital and diagnosed, and she died 4 months after being diagnosed. And I was only 21 at the time.
That's tough.
So I decided that, actually there was a nurse at Bryn Mawr who made a great impression on me during a very difficult time. And she was the reason I went to nursing school. And actually 10 years later, I saw her down in Center City at a restaurant, and I approached her and I said, "You're the reason that I went to nursing school." And she said, "Oh, you know," she was great sense of humor. She's like, "Oh, don't tell me that. I don't want to be, you know, gonna get credit for that." And I said, "No, it's true." So nursing had never been even in my head early
Isn't that
on.
amazing? So that was really like a watershed experience.
I think that the experience that I had with Mom's diagnosis and treatment and the nursing staff at Bryn Mawr really made an impact on me. And I realized how much nurses can impact someone's care and a family's response to that care.
Right. Can you remember why that particular nurse just touched you so deeply?
Yes, I remember coming to the hospital after I called my father, and he said, "It's malignant." So I was working at the Philadelphia Inquirer, going part-time to school, and I drove to the hospital, and I remember Marcia was her name. She saw me coming. She knew that it was going to be a difficult visit, and she took us, my sister and I, and said, "I'm going to put you in the chapel," when they had chapels. "I'm going to put you in the chapel, and I'll bring your mom in." So it was the acknowledgement that this is going to be difficult for you.
Right.
And then when she dealt with my mom, she just had so much humor.
Oh.
And my mother really appreciated that. Back then they gave shots for pain, and she always made a big joke and said, "Peg, you know, here I come." And so it minimized some of the darkness of it.
Right, right.
But that was the turning point, and I thought, you know, I love helping people. I'd never thought about nursing. No one in my family is a nurse. No one is in healthcare. Okay. So I was really, it was scary to go into nursing because I thought, I've never had an interest in this.
I think that's like such a world away of wanting to have the avocation or vocation, rather, of being a sports writer.
Right. Totally different. Totally different.
But I mean, obviously that was meant to be, Betty. Look what happened.
Yeah. And actually, I've said this many times. Ever since graduating from nursing school, I have never regretted a day being a nurse, ever. So it was a good decision.
That is a good decision.
I would rather have had my mother live a couple years. But,
right. But what a gift. And I think that the lesson learned in what you've said about that experience was all the nurses were great. As a team, you know, you felt that they all did a good job.
Yes.
But what really made this nurse different is she really partnered with you and your mother.
Yes.
And the family.
She really understood what we were going through and went outside of what I thought a nurse was. You know, nurses do this. But she really got it.
Right, she got it, and she could get right inside everyone's heart.
Yep.
As well as, you know, give shots and do the technical things.
Do the technical stuff, yeah.
So then when you became a nurse and you got out into the field, you know, what was your journey like in the beginning?
Well, when I was in nursing school, I was lucky to get a nurse extern job in a cardiac care unit at MCP Hospital. And so, again, the nurses were very influential in helping me and saying, here, Betty, try this, try that. Oh, no, I don't want to. But they were, they were very good about pushing me. And that experience, I did that for 2 years, and then I graduated. And they did not accept graduate nurses in the critical care unit at that time. So I moved to Einstein in North Philly, and I worked night shift in the ICU and CCU because I wanted to work in critical care because I'd had that nurse extern experience.
So even though most places didn't take new grads, they would take them on the night shift.
Exactly, as long as you have a pulse and a license. That's right. So that was a good experience. And then when I had the experience to go back to MCP, I went back there. I really liked the fact that it was the first women's medical college at the time. It was a community hospital. It had a lot of fondness for me because of the mentoring that the nurses had done for me.
Right.
So,
you know, I think this is a little bit of a sidebar, but given your interest in sports and your abilities in sports, they always say that, you know, really what makes nursing somewhat different than other professions is that it's such a team sport. You know, to really work well.
Yeah, good point.
The difference between some hospitals, Hospital A versus Hospital B, has to do with the teamwork with the nurses.
That's a great point.
You want to speak to that in terms of your experience?
Yeah, I mean, I've always been a huge fan of team sports, and I've participated in them, and I think that young girls should too, because it teaches you how to work with others, and to understand that you may be really good at something that I'm not good at, so I want you on my team. And I am good at something that you're not good at, so you want me on your team. So to work in a nursing unit where we all complement each other, I think that's a great value to the patient.
Right. It sounds like at MCP, one of the reasons you went back to that is that you felt that they had that team spirit.
Absolutely. I mean, and they mentored me, they encouraged me, they pushed me, they supported me. It was a great experience for a student nurse. And when I speak with nursing schools or students now, I say to them, if they can, get a position in a hospital somewhere, just to be experienced and let people know who you are as a person.
Right. Very good. So then you journeyed on and you got into, you got beyond your student nurse early experience, you know, as a new graduate, and then you decided to really go into cardiology?
Yes. I think that attracted me. The cardiology attracted me because it was critical care, but it wasn't necessarily surgical. And you had a chance to develop relationships with patients. So that attracted me. And then I just kind of developed into the cardiology department and working in the cath lab, non-invasive stress tests. So it was a journey for me as I was going to get my master's degree. And then following getting my master's in health administration, I went into nursing administration to supervisory roles. I went into long-term care as a supervisor. So I was just really exploring management at that level.
Now, a lot of times people stay at those levels because there's many rich opportunities
Right.
in the marketplace, and people can really advance from there.
Right.
Did you have a sort of a crossroad experience which said, you know, I could do this, but maybe there's something else I should be doing?
Well, I think my experience at MCP helped. We implemented a new computer system, and I was the point person as the director in that role.
Okay.
And I thought, this is kind of interesting. This would be a nice new thing to do. And I eventually left the hospital and went to Shared Medical Systems, now Siemens, and worked as a consultant implementing clinical systems. So that was another journey toward my role now, to understand the role that systems can play, computer systems and information systems. I think that was another kind of, we're all products of where we came from.
Right. And what years were they?
1995 to 2001.
So you were really on the cutting edge of a lot of application of new systems to healthcare.
Yes, that was the day when we did outpatient clinical documentation, and there was a lot of insurance systems, but there wasn't much for nurses. So Shared Medical had hired a bunch of nurses to kind of help that process along. So it was an exciting time, but I missed patients. I missed being in the hospital.
Right.
So when I returned in 2002, I felt like healthcare had changed.
In what way?
No one was thinking about the patient. It was awful. Talking about teamwork? No.
Well, what changed that so dramatically? You
That's
only stepped out of those forums for maybe 5-6 years. What happened?
Nance, if I knew that, I'd be, in a different role. But
You think it had to do with the computerization?
I don't know. I think when I went back into the role as a nursing supervisor working 4 to 12, I thought, what's happened? And so I started to think about patient advocacy. Like, what happened to teamwork? What happened to communicating? What happened to caring for the patient? And it may have been the facility I was at.
That's true. I mean, I think that that's a good point. There are variations in teamwork and just the overall organization of hospitals. They're not all the same, just like any business.
Right.
You know, it's not all the same. Stores that you go into, certain stores are friendlier, they have better service,
Yes.
they have better products, etc. So, I mean, in some ways, we tend to sort of blur out and think of healthcare as just healthcare. It's all the same, but it's not.
Oh, good
so
point.
maybe that was,
Right.
a pivotal difference, but you weren't able to assess that at the time. All you could see is that from your point of view, there was a change. It was not for the better, and then you saw opportunity. Now, I think that's important because some people would just go back into a setting and just say, gee, ain't it awful? Too bad it's not the way it used to be. And then just sort of go along with it. But you saw that there was something missing. And then how did you decide, how could I address that?
Well, yeah, that's a good point. I think that I realized I'd always thought about how can we improve things for patients, right? As a director, as a nurse, as a supervisor. But when I took a look at the process, and I would get calls on the evening shift, hey, Betty, can you come down and talk to Mrs. Smith? Well, why? What's going on? Well, our family's angry. What are they angry about? I don't know. So my role was to go down and say to Mrs. Smith, what's going on? And I would learn that there wasn't much communication. Well, I don't know why my husband's not eating. Oh, well, let me check. And you find in the chart that he's scheduled for a study the next day, and they're keeping him NPO. Oh, okay, well, didn't anybody tell you that? No.
So what you're saying is that these would be relatively simple communication gaps.
Absolutely.
Like
Absolutely.
almost like the no-brainer, like why wouldn't that other person
Absolutely.
have told them that rather than take the time to like dial the phone and call you to tell you that they didn't know what they were doing.
Exactly.
So you started to see that there was some very simple pieces to this
Yes.
puzzle, but that you couldn't necessarily get the other people to step up and do that piece of the work
Absolutely.
for whatever reasons.
Yes, and on a personal level, at that time, my uncle, this was 1999, I guess, my uncle had fallen, and my aunt and uncle lived in South Philadelphia. They didn't have any children, And Aunt Betty called me and said, Uncle George has fallen and he's at Jefferson, and I don't know what's going on. Okay, so I went down to the ICU, and the resident is talking to my Aunt Betty, and he's talking, and she's 85 years old, and she's just kind of looking at him and shaking her head. And I'm looking at the two of them thinking, she has no idea what he's telling her.
Right.
And what do other families do that don't have someone like me to be listening to this conversation?
Right. One of the takeaways is that every family needs a nurse because that we're all called upon to do that
Good point.
translation.
Right.
But not everyone does have a nurse.
Correct. And so what do families do who don't have nurses if they don't have a physical therapist or a physician or someone that can interpret that
Right.
for them? So I started to think, well, would this be a good business to do? Because we could help patients figure out the healthcare system. So it took me a couple of years, and I would say to my colleagues or to friends, do you think that you would pay for a service like this? Oh, absolutely. Yes, that would be so helpful. And so it started to think, okay, maybe this is an opportunity for me to help families through the healthcare system.
So this is not exactly the Wharton approach to business planning.
No.
You obviously flunked the course, but you actually got a grade, a very good grade at the
That's
end.
right.
So you just sort of went around and sort of did your own soft pulse taking
Yes.
of the market potential. And,
Yes.
and based on that, then what?
Well, and as you know, there's a lot of good ideas, but are people going to pay for it?
Right.
Right?
Right. So,
So-
you asked the first pivotal question. Do you need it? Yes. Will you pay for it?
Correct. And that was probably back in 2002. And in 2003, Guardian Nurses was incorporated. So this is our 10th year. I'm very excited about that.
Great. Congratulations.
Thank you. It's very exciting. So I started with two other colleagues. And the first year, I made $15,000. And I thought, well, this is a great hobby. So I either have to charge people, because oftentimes I would get into relationships with, Nancy, it's okay, your mom's sick, don't worry. And that wasn't a great business model either. Wharton would not have.
That's another thing that I think a lot of times, this is a bit of a stereotype, but women tend to have relationships and tend to give a lot of help or advice or time because we have that family or friendship.
Sure.
So you don't really feel comfortable necessarily charging people for that.
No, and nurses have never, and you know this as a chief nurse, nurses don't value what work they do.
That's true.
And the healthcare system doesn't value it.
Well, we won't get into that in this
Okay,
show. But
sorry.
other shows, we'll definitely have that discussion. But I think that with nurses, we tend to be givers. You know,
Correct.
I mean, good nurses tend to be very kindly and thoughtful and giving. That doesn't mean they don't have their tough side as well.
Right.
But that's part of like the nature of the profession.
Sure.
And so it's really hard to convert that for some people into a business model.
Well, it took me a year, and then what I realized is that the opportunity to, how could I provide service to families and have someone else pay for it? So I was fortunate enough to have an opportunity to get the contract with the Philadelphia Police Union. And that made a lot of sense to me because the union paid for our services, and I could deal with the patients without ever bringing up the cost.
That's good.
And that made a lot of sense. And these folks were not highly educated. They were blue collar. They followed orders. So their journey through the healthcare system was really the way the doctor said it was supposed to be. So our services at that point were really helpful at guiding them, and we got paid. So that was a big deal.
Right, right. So that gave you sort of a baseline
Right.
for really, growing.
Correct.
At least you could make a living. You could
Right.
do some basic work. With a population that, were they getting services or was
Yes,
it
they have a great plan, but as you know, with a great plan, then not under much direction, they were going everywhere.
Right.
And so oftentimes it was just like, okay, well, let's slow it down. What do you need? Who do you need to see? And, well, I need to see this doc. No, let's see that one first. Because as a nurse, you can assess what their priorities need to be.
Right.
and try to guide them.
Right. So in this world of patient advocacy, your advocacy was really focused on a lot of coordination of services.
Correct.
Getting the basic services, getting them in a timely way,
Yep.
and getting them in the right sequence.
Yes.
Which is a huge service, because people often know that they have maybe 3 or 4 things that they have to attend to, but really don't know what the factors are that would contribute, really ranking that in
Correct.
a way that they can actually then manage and then follow up and actually do.
Right, because they're patients. They're not necessarily passive, but they want to know where to go to make the most efficient use of their time too, because it's time consuming to go through.
So a lot of this is a planning activity.
Yeah, it's planning. It's getting to know what the patient's needs are. It's much like the nursing process in the hospital.
Which is, explain to our audience the nursing process.
Okay. It's assessment, plan, intervention, and evaluation.
Right.
So it's a constant thing. So patients' needs come up, and maybe you eliminate that problem, but you have to continue to assess it. And I think as nurses, and as anybody who's caring for people, you want to make sure that the process is smooth. And what we discovered that first year was that just a little bit of energy in the direction of coordinating the care resulted in over $1 million in savings
For the union.
for the union.
They must have really liked that.
They were very happy. And so we have continued with them through 7, 8 years.
Right.
And it's been a great relationship for us, because we really do value the work that we do. I mean, being a police officer in Philadelphia is not exactly a great job. So.
Well, it's a very challenging role,
Absolutely.
and I want to thank the police of the city of Philadelphia every day out on the front lines, really
Yep.
protecting the population. It's a tough job.
Yes.
And so, these are not people that are going to spend a lot of time coordinating care for themselves.
Correct.
I mean, they're out there doing their jobs, taking care of their families,
Right.
and living. So I think you coming in and your service, helping them to coordinate something and making life better for them, is a tremendous contribution.
Correct.
But I'd also just like to note about the savings. Often money is spent in the healthcare system in ways that really don't profit anyone other than providers, and it's not that they're necessarily looking to profit, because they're not coordinating the care either. They're just doing the intervention. They may be doing a consult for cardiology. They're not necessarily coordinating, with the family doctor or with someone who is working with their heart and their lungs, in addition to their heart. I mean, there are all these different fragmented parts.
Right.
And so a lot of money gets expended, but it doesn't necessarily contribute to the bottom line health of the individual. So part of what you're doing is really playing a role in healthcare reform, because a lot of the healthcare reform is on this coordination of care. Right. How to get the most for the dollars that are there. So if you have $100, you want to get $100 worth of coordination and service. You don't want to get $100 of something and then find out you need another $100 for something else you didn't get that could have been used in that first, expenditure. So I think this coordination is hugely important.
And just as you bring up with the healthcare reform, it's also transitions of care as well. So it's coordination of care, and then when they're discharged or transitioned to another level, that somebody's there to make sure that the ball is handed off properly.
Right.
And that we see that all the time.
Right. But in terms of your role as an entrepreneur, and so you had this first, I think I'll get into the pond. I think I'll try to get at least one contract to stabilize. Were you 10 years ago sort of out in the wilderness? Were there other services? Were you unique at that time?
Yeah, that's a great. There was one other vendor who provided service in a corporate type setting. There were other nurses and social workers who provided service as geriatric care managers. So there was the role of coordinator, but not so much advocates. I mean, not so much. So yes, 10 years ago, when I think about where we were 10 years and where we are now, there's much more notoriety about patient advocacy. Hospitals are developing patient advocacy programs, but back then, there wasn't anybody out doing it.
Right. So you're really a pioneer.
Okay, thank you.
You're too busy trying to just get your business going to think about your pioneer.
Like a hat and a covered wagon.
Well, it is a covered wagon because you're out there, just right on, again, on the front lines, driving that wagon right up to the people.
Right.
That's a point right there. You're going to the people that need services. You're not expecting them to come to you in an office far away somewhere.
No. In fact, thank you for mentioning that. One of the unique things about our service is that we go with patients, accompany them to appointments, and are listening to what the physician says to the patient so that we can interpret that for the patient and their family. And that is something that is really valuable over the course of the 10 years, to actually see the interactions between the physician and the patient and be part of that and be able to impact that and scooch it a little bit maybe, or you kind of see that they're not really understanding what the doctor's saying, and you can impact the doctor to say, hey, so what I hear you saying is this. It's very helpful, very helpful.
So for you, knowing how to do the service was the easy part. You sort of knew from your nursing experience, from your management experience, what people needed. It was the business piece that you really had to learn by the seat of your pants, so to speak. I mean, literally. What advice would you give to other people, other nurses, other people that are interested in trying to solve some of the problems in healthcare, just based on your background? In our closing few moments, what would be some of the points of advice?
Well, I would say to nurses who are wanting to do this that you need to value your services. You need to understand that to go out and be a solo entrepreneur is not easy.
Right.
And there will be challenges, and you need to figure out how you're going to overcome those challenges. And that, I think, when I've coached and mentored other nurses around the country who've done this, when I ask them, well, how much are you going to charge for your service? And they'll say $30 an hour. And I say, okay, can you live on $30 an hour? Because we're used to making this much in a hospital setting.
Right.
But now you don't realize that when you're out marketing and meeting with folks, you're not billing a patient or a union or a client. And so how much money do you need to make? Are you married? Do you have someone who can help support you? So there's a lot of things to consider, and there's a lot of skills that you need. That meeting people at a networking event.
Right.
If you're an introvert and you really like patients, but you don't really like talking to strangers and saying what you do, that'll be a challenge.
Right.
So I am blessed to have had a lot of lessons proven along the way, but I do think there's a lot to be said for starting your own business now that
Well, I think that Betty's background in journalism and in sports really was a great background for getting knocked down as she started out in her early experience as being an entrepreneur. But what's most important, as you know, in sports, it's not getting knocked down, it's getting up and brushing yourself off and going forward and learning from each of those experiences so that you can really, get better the next time. So I think a lot of people that are risk adverse don't want to get knocked down and have to brush themselves off. But you're still standing, Betty.
That would not be if you're risk adverse, starting your own business is not really top. It shouldn't be on your top 5 list.
But I want to thank Betty because what she is doing has made a difference for many people. And she is going to be doing a show where she will be telling us in more detail exactly what her business has to offer the public. But I think that what we've learned in this show and what Betty has shared, so openly is her own life journey as a professional and how she was able to step out of the boundaries of a traditional healthcare system and how she used that stepping out to not only her advantage of now owning her own business and being a successful entrepreneur, helping other people to become entrepreneurs, but helping to bring those services that were really not there before to other people and really bringing value to their personal health care. So Betty, thank you so much for being with us. It was a pleasure.
Thanks.
All right, take care, and thank you very much for joining us for this session. Have a wonderful day. I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening and join us again. And remember, with health, all things are possible.